Speaking to Naomi Wolfe about her book, Vagina, a Biography. That's what the book is called. And as you might imagine, this segment may contain some adult content. You may want the children to scoot on out. A lot of misunderstanding about female sexuality and arousal anatomy. If you've got questions, call us, 855-DR-Drew5. I'm also joined by Simone, Bienne, co-host on Loveline. And I've asked Dr. Jennifer Park, OBGYN in Pasadena Fair Oaks Women's Health Center, to join us because there's a piece of this that I didn't want to miss, Dr. Park, and that is, as we age, the importance of hormone replacement and how hormones like testosterone, and again, has been left out of the conversation so much, can vastly improve people's sexual responsiveness. Tell us about that, if you can. Uh-oh. Dr. Park, are you there? Well, let me, I don't think she's hearing me, so we'll go on past that. Simone, Bienne, what did you think of the conversation we were having with Naomi Wolfe?
Absolutely fascinating. Now, you know that I'm a huge fan of Naomi because I actually wrote my dissertation for about one of her former books, which was The Beauty Myth, many, many years ago.
I'm so flattered.
Yeah, and I wrote it from a liberal feminist standpoint, which is one of the typical lines you say when you're writing a dissertation. I thought it was really, really interesting because, I mean, you both talk very much about the response, and I liked Naomi when she talks about housework being foreplay, which is something that you and I always say.
Simone said that for as long as I've known her, yeah.
And how important it is for women to understand that our sexual arousal system isn't the same as men's, and what this needs to be, Naomi's right in the sense of we need to get this message out there, because if we think that our arousal system is as simple as men's, then no wonder we feel bad about ourselves, you know, and that we don't know our desire, or you know, we don't have sex.
Or we feel less than if we don't have orgasms a certain way as women.
Absolutely, yeah.
So Naomi, this is an important conversation. I'm glad you're raising it.
I'm so happy hearing this validation from people who know this field, because it hasn't entered the culture. You know, what I often say to audiences is that, you know, we're stuck in a model of the two genders being the same in their arousal, dating back to Masters and Johnson, and it's like, you know, arousal, plateau, climax, resolution, and a race to the finish, and that doesn't work for women because men take on average 4 minutes to reach orgasm and women take on average 16, not to mention the incredible variability, which I think you were about to talk about, between the male neural wiring in the reproductive system in the penis, if you don't mind my saying that word, versus the incredibly complex and beautiful and you know, valent, you know, wiring in the female pelvis, you know, the vagina, the clitoris, the perineum,
mind you, Naomi, you're talking about wiring just in the pelvis. The wiring in the brain is vastly different, male versus female. Vastly different. Right. We are listen, we differ from each other by an entire chromosome. We differ from chimpanzees by about 300 base pairs, a part of a chromosome. So, of course, men and women are different. Of course they are.
And what's very interesting...
to hear more about, what you were going to say about what the takeaway is for us in terms of understanding our sexual desire.
Me or Simone?
Simone.
Go ahead. Go ahead.
Well, I think it's really simple. I'm actually writing a book sort of to help women explain and understand, you know, the emotional connection with the vagina, and that's really, really important because women can feel a lot of shame because even anatomically, you know, we don't hold our vaginas to pee. So even from a young age, we're not touching down there. We haven't had that kind of relationship. We're not naming our vaginas like men name theirs. They're on best friend terms with their penises. We need to be in that same kind of relationship if we want to really enjoy our sexuality. And that's sort of my angle, and I really respect what Naomi's saying. And if we can just all get out there and all get the message to women, love yourselves, love your vagina. It's an enormously important, beautiful, luscious, wondrous
part
Simone,
of yourself. Stop it. Settle down. Now, settle down. All right, let's go to calls. Pam in Georgia. Pam, what do you got?
Hi, Dr. Drew and Naomi and Simone. And I actually have a comment related to the endocrine system.
Yes.
I'm 45 and had my son at 39. And after he was born, I took a low-dose birth control, and it was not one that I had taken prior to his birth. And my libido disappeared, and I didn't even realize it because I was a new mom, and, you know, there's so much going on. And after I stopped taking it, it returned, and you know, I had not even realized that it had disappeared medically.
Yes, let me address it. How about that? Since we didn't get Dr. Park, who I was hoping to really give us a little primer on this, let me just say that these powerful progestational agents, progesterones that are in common birth control pills today, commonly shut women down libido, give them irritation, vaginal dryness and irritation. It isn't discussed with them. It's terribly common. The second issue is perimenopause often hits in the 30s, certainly in the 40s, and can have a dramatic impact on your sense of well-being, your ability to connect with your partner, and there are replacement strategies, bioidentical or otherwise, that are extremely effective in restoring people. I have personal experience where women are angry that someone didn't come to them 10 years prior and say and offer this because they've had years and years of not feeling like themselves. This is a time when we can't do that. Naomi, finish me up. We got to go to break. Go ahead.
Oh, I was just going to say thank goodness for this conversation, because so many women are saying to me, I went on the pill and lost my libido, and nobody told me that that's what would happen. The minute I heard from your book that this suppresses desire, I went off the pill, and now my libido's back. It's saving my relationship. And also, so many older women are asking me, what do I do about maintaining desire? And so I wanted to hear more about what
Dr. Park uses bioidentical pellets too. There's lots of options out there. And be careful, I'm not vilifying the pill, because some of the birth control pills intensify libido. It's certain ones in certain women. Women are very complex, very different, so these progestational agents tend to be the ones that suppress. A doctor might prescribe a pill with more estrogen to enhance desire. Sometimes, if it's appropriate for you, again, discuss these things with your physicians. He or she is very accustomed to this conversation. I've got to take a break and switch gears into something called Our Country Votes. Take a look at this. Did you know that Winston Churchill had a tattoo? Congresswoman Mary Bono Mack has one as well, Jesse Jackson Jr. So we asked, if you were a politician, what tattoo would you have put upon your body? Because a lot of, apparently even like Teddy Roosevelt had a tattoo, but I guess he was a Rough Rider. I guess that's how they saw themselves then. Nicole writes, I would have a big giant peace sign, and Vicky, Channeling G, can't quite read that. Somebody says, this is a G, President Kennedy says, ask not what your country can do. Oh, she's channeling President Kennedy. I see that. Ask not what your country can do for you. Ask what you can do for your country. Those would be good tattoos. All right, thank you guys. Next up, more calls and comments. Stay with us.
Our Country Votes 2012 is brought to you by coal, the dominant source of our electricity. Clean coal. Now's the time. Go to
All right, we're having an in-depth discussion about female sexuality with Naomi Wolfe and Simone Bienne, and I was just going off about female endocrine systems, and I've got Dr. Park on the line, I believe now. Dr. Park, thank you for joining us. Can you just give me a little primer here that substantiates what I was saying about the aging of population, female sexuality, arousal, and libido, and the opportunity for replacement?
Oh, yes. I mean, hormone replacement can help, honestly, with sexual desire and satisfaction menopausally. Number one, I give women both estrogen and testosterone. The estrogen helps with vaginal lubrication and the vaginal caliber of the walls, and it makes intercourse much less painful. In addition, testosterone can help increase desire.
Is there something?
The woman's receptivity to intercourse.
Well, receptivity is more the estrogen function. The testosterone is more the drive and desire, I would say. But let me ask this. Is there something we need to be telling people to get the word out that as we age, these are normal things and they can be restored?
Yes. I mean, I try to educate my patients as much as I can. And just tell them that what they're experiencing is normal and that we can do something about it.
Thank you, Dr. Park. And Naomi, you've always been a good source of putting the word out there, let's say. So this is another chapter I'd like you to add, or maybe your next book is, or something. Get more information out there for the population as they age, because relationships are falling apart because people don't know about this.
Yeah. It's really true. I'm sure every single bookstore event I do, older women in their 50s, 60s, and 70s say, what can I do to boost desire? And they don't know this basic information that Dr. Park just shared. They also don't know, I didn't know, that as Dr. Jim Faust says, female sexual desire has a kind of use it or lose it quality, so that you do have to take care of your sexual health. You have to I mean, doctors never say you should be sure to masturbate regularly to women if, you know, they're not in a relationship. You know, women really do need to kind of take an active role in taking care of their sexual health and well-being. That said, I keep meeting women in their 50s, 60s, and 70s who are having passionate love relationships and sexual relationships. So this stereotype that it just has to dial down isn't the case.
No, and
but the information that you all are sharing is very
especially
vital.
now that we are living so much longer, we have to prepare for that. Denise in Virginia, you got a comment? Denise?
Yes, hi, how are you?
Good.
Okay, I'll just get right into it. Some females, when they have an orgasm, climax, they will, I guess, ejaculate. I don't know, they release fluid.
Right.
I'm wondering, how is that linked to the brain when I have heard that not every female does that?
Well, listen, this goes at a bigger topic, maybe we can get to after the break, which is the array of responsiveness amongst women. Women are all different one from the other, and no one is right or good or better. I'm gonna have my guests answer that and address that as soon as we get back from the break. Be right back. We are discussing female sexuality. Thank you for joining us. And Simone, you were going to tell us that caller asked us about the spectrum of orgasmic function in women.
Yeah. Now, obviously, as women, we have very many different ways of orgasming in the sense that...
Any given one does.
In any given one time. And there are women who are multi-orgasmic, there are women who struggle to orgasm, and whether there'll be a blended orgasm with a G-spot or with a clitoris, we're obviously very complex beings. And the whole message that I want to give to women...
And no one is really the same. There's no...
Exactly.
Yes,
and no one is the same. And also, even the same sexual experience won't necessarily, bring you to orgasm in the same way, even though yesterday it worked perfectly fine. That is how women are.
That's how
we are complex. Yes. If you thought your wife was complex, anyone watching right now, well, when it comes to our sexuality, we're even more complex. But the point is, an orgasm is an orgasm is an orgasm, and don't judge your orgasms.
Women tend to compare one versus the other, or they compare it. Right. Naomi, this is why I really appreciate your book. They compare it to a 17-year-old male, which is like comparing it to a polar bear or something. It's extremely wrong. Right. I've got about 30 seconds left. Where do you want to take this? What would you like to say? Naomi.
I mean, the last thing I want to say, chiming in with what Simone was saying, is that men are not taught how important seduction is, not just to get the woman, but to keep the woman aroused and interested for the rest of her life. It turns out there's a scientific basis to why dim lights, gazing, stroking, caressing, dancing are erotic for women and activate that arousal response. And I think, men are very happy to learn this.
Arousal.
They don't get taught it from our culture.
And then the desire often comes, or one of the mechanisms as well, is intimate conversation. Guys, they seem to want to talk a lot.
Very sexy.
See, pay attention to that. Thank you, guys. Thank you, Naomi. Thank you, Simone, for joining us. Thank you, Dr. Park, as well. Thanks to all my guests. Brett Butler, thank you so much for joining us earlier. I'm Bob Forrest. Thank you for watching.